If you have a urinary tract infection or UTI, it's important to consider the potential link with diabetes. Here are 2 things that you need to know. Number 1. Why people with diabetes are more prone to urinary tract infections. Number 2. Can diabetes medications be linked to urinary tract infections? This is due to several factors. Let's explore why this link exists. Weakened immune system. High blood sugar levels in diabetes can weaken the innate immune system. This impaired immune response makes individuals more susceptible to infections, including UTIs. Specific factors associated with diabetes and UTIs. Longer duration of diabetes. Individuals with a longer history of diabetes are at higher risk. Glycated hemoglobin, or HbA1c. Elevated HbA1c levels, which is a long-term marker of blood sugar, correlate with increased UTI risk. Sugar in urine. Excess glucose in the urine provides a favorable environment for bacterial growth. White blood cells in urine. Elevated white blood cells indicate inflammation and infection. Increased bacterial adhesion. Bacteria adhere more readily to the urinary tract lining. Bladder dysfunction. Poor bladder contraction and incomplete emptying contribute to UTIs. Poor circulation and immune function. Diabetes-related vascular issues affect immune responses. Role of psoriasin. A recent study found that high blood glucose levels reduce levels of an antimicrobial peptide called psoriasin. Psoriasin perform as an initial defense against bacterial infections. Reduced psoriasin weakens the protective barrier function of cells, increasing the risk of bladder infections in people with diabetes. Prevention and management. Control blood sugar. Proper diabetes management helps reduce UTI risk. Hydration. Stay well hydrated to flush out bacteria. Urinate regularly. Empty your bladder promptly after feeling the urge. Good hygiene. Wipe front to back after urination or bowel movements. Consult a healthcare provider. Seek prompt treatment if you suspect a UTI. Increased risk of UTI with diabetes. If you have diabetes, you are twice as likely to contract a UTI compared to individuals without diabetes. UTIs are also more common in women than men. Pregnant people and older individuals with diabetes are especially at risk for UTIs. Symptoms of UTIs. Classic symptoms of a UTI include pain or discomfort during urination, frequent urge to urinate, cloudy or bloody urine, lower abdominal pain or discomfort, fatigue, weakness, nausea, and fever. Why the link? High blood sugar levels in diabetes can lead to increased sugar in the urine, creating a breeding ground for pathogens. Diabetes-related issues with urination can also contribute to UTIs. Diagnosis and treatment. If you suspect a UTI, consult your healthcare provider. They will test your urine for bacteria and pus. Treatment typically involves antibiotics. Prevention. To prevent UTIs, drink plenty of fluids. Urinate when you feel the urge and after sexual activity. Wipe front to back after urination or bowel movements. Remember, early diagnosis and proper management are crucial for both UTIs and diabetes. If you experience symptoms, seek medical advice promptly. Can diabetes medications be linked to urinary tract infections or UTIs? Wait, there is more, but do not forget to hit the like button and subscribe, down below. Metformin, a commonly used oral medication for type 2 diabetes, is generally well tolerated. However, some studies suggest that metformin might be associated with urinary or bowel incontinence. While it doesn't directly cause UTIs, incontinence can increase the risk of infections due to poor bladder control. SGLT2 inhibitors. SGLT2 inhibitors, such as empagliflozin, dapagliflozin, and canagliflozin, are newer antihyperglycemic agents. Risk. Studies indicate that SGLT2 inhibitors are associated with an increased risk of genitourinary infections, including UTIs. These medications work by promoting glucose excretion in urine, which may affect the urinary system. Other considerations. Blood sugar levels. High blood sugar levels can impact blood flow and damage nerves, potentially affecting bladder function. Immune system. Diabetes interferes with the immune system, increasing the risk of infections, including UTIs. Prevention and management. Hydration. Stay well hydrated to flush out bacteria. Good hygiene. Proper hygiene and wiping front to back after urination can help prevent UTIs. Regular checkups. Annual kidney health checks are essential for the early detection of kidney-related issues if any. Do not forget to click the like button and subscribe. Up above you see a video related to health. Thanks very much for watching this video. Subscribe to my channel.